Dr. Dennis Lai, the head of surveillance, and also who has oversight over port health, will also give us a briefing on the situation at the port and all the, I'll say, the misinformation that's going on. Continue to increase. Previously, we were reporting just a few Greater Accra, Metro, and its environs. Now we are seeing some spillover into some of the neighboring districts. Adherence to protocols still remains very poor across all the regions, and the probability of a much severe third wave is high if we do not increase our adherence to the protocols. So as at 25th of July, we have recorded in total 102,269 cases. We've done about 1.4 million tests. Total recoveries about 97,213, which is the difference between the total cases and active cases. The active cases about 4,983, and the reported deaths so far, as calculated on the 25th, is 823 deaths. I think you can see the curves. I would say that the two, and four curves, the mini ones, the two large ones, and you can see that the current situation, the numbers continue to increase. So you can see that the spike is going up and up and up. But the next slide also shows us what is happening in the two main regions where it's driving the epidemic, which is Greater Accra. Up there, you can see the rise. This is up to about, say, about a week ago. And down is Kumasi. So you can see that spike is pushing the national data up. And so the active cases continue to now go up very significantly and a very steep rate. So a lot has to be done to ensure that we don't get into a more severe situation than we had in the February-March episode. Among the international travelers, as at 27th of July, we have had a total of 2,249 cases, and total tests done so far is 390,520 cases. A significant number, about 2/3 of the numbers, are non-Ghanaians. You also see that even though July has not ended, we have actually crossed the number we got in April, and we are heading towards the January, February numbers. And that's quite worrying. As we said, our neighboring countries have cases, and generally, Europe and America is also experiencing some increasing number of cases purely because of the Delta variant. The next slide. And so if you look at our airport cases, you can see that in terms of the total number of countries who are bringing in more cases, you can see the top 10, starting from the USA, Nigeria, UK, and down, and so forth. So those are the areas we are having, and that is why we tend to have people from that area complaining, because they are also contributing the number of positive coming into the country. Subsequently, the Director of Surveillance will speak to that, and we'll see how these things tend to refer. It's also important that one of the key areas to look at is what is our bed state? How are we doing as far as the cases are concerned? Currently, case on admission across the country is 248. 17 are critical. Severe cases about 86 across the country, and total and mild cases 143. So you can see that even though the mild to moderate still are high, we are having 17 critical cases, and that is still quite significant compared to the last time we shared the update. The schools remain practically the same. A few outbreaks have been recorded cumulatively of 2,647 since school reopened, with 93% recovery. Currently, there are about 166 active cases going on. We have about 38 in OT, which is just coming since the last 3 days. And that school, we're still monitoring to see how we can contain the school. A team has been dispatched to the school to assist the district and the region contain the outbreak immediately. Greater Accra has 15, Ashanti has 93 active cases in schools, Eastern 12, Bono 7, Bono East 7, and Bono 1. As we said, of the cumulative cases, Volta region has the highest so far, but also currently do not have any active case in the place. Northeast, as we keep saying, is the only region that is yet to report any case at all. And so the details as appear in school is in order of preference. The highest in Ashanti, followed now by OT, and Greater Accra as the third in terms of the number of cases. Okay, so the most of the other regions from Central, Northeast, Northern, Savannah, Upper East, Upper West, Volta, Western, and Western North, there's no active case in the schools. In terms of the vaccine, I think not much has changed in terms of the number of doses that has been given. But in terms of the outlook for vaccines in the pipeline, there's been some changes. We're having about 1.229 Pfizer coming from the US through COVAX facility is to be coming in soon. We are here to confirm the dates. We try not to give date, but as soon as we have an indicative date, we'll share. We also have an AstraZeneca of 249,600 has been shared earlier. We're hoping early August it should be in. We've had a deposit made for the 17 million Johnson & Johnson with the African Union, which the date is yet to be decided when we will start receiving them. But what is new is the fact that we are going to get some AstraZeneca from Korea. This is something we didn't talk about. This is a new, and that will be in August, and as well as Pfizer, another 100,000 with a date to be decided. And so the number continues to increase. We are hoping that we'll have a lot more, and then if you start having the 17 million come in, that'll be the time we can significantly vaccinate more people. So the outlook generally is that we are experiencing a third wave, a major spike that can be described as a third wave. There's a high risk that the severe third wave may have a higher, much more severe wave compared to the second if nothing is done. And this is happening because we are also still not adhering to the protocols, and we would have expected a lot more people adhering to the protocol, but we've still not seen enough. We're going to start the mask surveys to see how people respond and how it relates to the decline or otherwise of the numbers. We still have to look for more isolation centers if the surges continue. We are also non-adherence to isolation by affected persons undergoing home treatment, and that's why we are enforcing more facility isolation. And one of the key challenges we are having is the fact that our vaccination coverage is still low. So basically, that is where we are. But I'll ask Dr. Dennis Lai will go on to give us what is happening at the airport, just to explain the rationale behind the setting up the center to test, looking at how the virus behaves, what is the protocol at the system, what is the rationale for that protocol, and also share with you some of other countries' protocol dealing with the same challenges that we are facing. So I will end here, and Dr. Dennis Lai will continue. No. We know, and Dr. Lai will say we do daily checks. FDA goes to verify the system very well all the time. For those who are there, on the third day, for sequencing reasons, we also do a PCR for comparison. But like I said, these are not two, they are two different tests, and they are two different attributes. So, but Dr. Lai will just do that. So the system has not been compromised.
Thank you very much, Honorable.